Welcome back, everyone, to Open Line. We have with us the Commissioner of the Tennessee Department of Health, Dr. Lisa Piercey, is joining us via Zoom right there. And we have a bunch of calls. Bill is calling back. So we lost Bill at the top of the show. Bill, are you there?
Yes, I'm here.
Go right ahead.
My question is why does Governor Lee pass it on to the counties to suggest to mandate masks when he's got the power to do it? It can save lives. It can save old people, young people, to save a lot of lives, and he's in the power to do it. And I don't understand why he's passing the buck on. You know, we have laws that you can't go inside a store or public places to smoke a cigarette because secondhand smoke it can cause cancer. I mean, there's common sense that wearing masks is saving lives because it cuts it down. If someone doesn't wear a mask, they don't know they've got it. They're next to me in the store and they're breathing. I don't have a mask on. They give it to me. I pass it to someone else. I don't understand. I'm not a rocket scientist. It only takes somebody with common sense to figure out mandating masks will cut this down.
And save lives. Okay. So there, you hear frustration from Bill. Why not mandate this if it will save lives? And we've heard you say that it should be a local decision, but here we know it will, I think we know it will save lives. Why not mandate it?
Bill, I'll tell you, I'm not a rocket scientist either, so I empathize with you. But what I know is that there are lots, as my grandmother would say, there are a lot of different ways to skin that cat. And there's no question that mandates are effective, but that's not the only effective way. And we strongly believe that mayors and local leaders know their communities better than we do at the state level. And not only do they know them better, they know the people and they get buy-in better. And so every county is different, and many of the counties have issued mask mandates. I don't think I've mentioned this before on this program, but we now have about 70% of the state's population are under a mandate already. So it's not just sparse, it's pretty widespread already. And then when you add the private sector policy in that, where you have stores and workplaces and schools, there are lots of different strategies to get people to wear masks. I absolutely agree with you. Masks are effective, they save lives, and I encourage every Tennessean to wear one, whether somebody tells them to or not, to take personal responsibility and do that.
Okay, let's keep moving along. Sherry, what's on your mind? Go right ahead. You may need to turn down your TV. I'm going to put you on hold and go to let's see, Lindsay, I believe. No, we're going to go to Chris. Chris, is that you?
Hello.
Hello, Chris. Go right ahead.
Yes, I wanted to ask you two questions. One is, do you really think it's safe that restaurants and bars are open? And number two, do you think it's fair that our mayor of Nashville has imposed restrictions that are stricter than Bill Lee's state restrictions? So Bill Lee gets to live in a neighborhood where it's safer, where the rest of Tennessee isn't. It doesn't seem fair to me, if you understand what I'm saying.
Okay, so yeah, that's a good question. And the restaurants, you're asking specifically, is it safe to go in restaurants? Is that right?
Yes, that too.
Okay, go right ahead.
So, Chris, that's a good question. I ate in a restaurant last night, and it is safe to eat in restaurants when they're taking appropriate precautions. I will say that if you ever have the option to eat outdoors in a restaurant, we know that being in an outdoor space is safer than being in indoor space, whether it's a restaurant or anywhere else for that matter. But when there is proper spacing and proper hygiene and wearing masks in the common areas of restaurants, basically when you're up and about, not in your seat, it is perfectly safe to eat in a restaurant. Now, having said that, you watch for those outdoor tables, and so while the weather's still good, I encourage you to eat outside anytime that you can when you're in a group setting. On your second question, even though it might not look like it on the surface, that actually crosses a little bit into some legalities about authorities for metro mayors and metro health departments. Mayor Cooper has the authority to make those more restrictive covenants in the Nashville metro area. and he has the authority to do that. He has done so. It's been effective. Nashville has had significantly declining rates, and I'm very glad to see that they're starting to open back up.
So do you support what the mayor did? Do you think that was the right call?
I think the interventions that he made have been effective. I think you can see a pretty precipitous decline in the numbers about 2 or 3 weeks after some of the interventions were made. And so I think it's been effective, and I'm looking forward to having things opening back up here in Nashville.
Let's go to Howard. Howard, is that you?
Yes. Hi.
Good. Go right ahead.
Yes. Hi. Good evening. It was widely reported on the national news today that the CDC made a stunning reversal of COVID testing recommendations today, saying that if someone does not have symptoms, they should not get tested, even if they think they've been exposed to COVID. Dr. Piercey, I'd like to hear your response to this. Given the high percentage of confirmed transmission from asymptomatic and pre-symptomatic infected individuals, and everything y'all have been telling us about testing for the past 5 months. Thank you.
All right, is the premise of that question true? Did the CDC reverse?
Well, I was just about to thank him for the question, because I was expecting, or maybe even hoping, to get that at yesterday's press briefing, and nobody asked. And so this is a great opportunity to talk about that. And what you mentioned actually is not entirely accurate. I think you characterized it, and you probably got it from the national media, a dramatic reversal. Actually, it really wasn't at all. It was some clarity, and it doesn't prohibit asymptomatic testing at all. What it does is it further clarifies when it's useful and when it's not. You know, the one thing it says is that if you're well and you haven't been exposed, there's really no need to test. I would tell you that today. I would have told you that 3 months ago. If you're well and you're just curious, it's probably not a good use of testing resources. What it says about those who have been in contact, it says you don't necessarily need a test, but if you get one, this is what you should do. And so I would encourage you, even though the CDC recommendations they're pretty long and it's hard to wade through for particularly non-medical people. But when you look at it, you'll see that it doesn't say don't do it, you're not allowed to do it. It just says, you know, if you're well and you were exposed to somebody and you're not having any symptoms, you don't have to get a test. And that's exactly what we've been saying all along.
And again, I'm being totally off the break, but I want to ask this. At the beginning of all this, they tested in the prisons, and they found, you know, the prisons claimed everybody in there was asymptomatic, and yet half of one prison, like 1,200 inmates in one prison, they were positive. The head of that prison said they were asymptomatic. If that is true, then if I'm going to go visit my elderly father, shouldn't I go get a test even if I have no symptoms? Doesn't that mean there are tons of people out there potentially that are walking around with this that don't have symptoms, and they should get tested so they can isolate?
I'm glad you brought that in, because you're exactly right. And there are provisions in the new CDC guidance, exactly what you're talking about if you are in the vulnerable population or going to go visit them or spend time with them, you should get tested, because there can be asymptomatic transmission. And so just a little bit of clarity to summarize, the CDC does not prohibit asymptomatic testing. They just clarified on when it's helpful and when it's not. Final thing before the break, all health departments are still doing testing of people regardless of symptoms, asymptomatic or not. So if you are in one of those situations where you're asymptomatic but think you need a test, go get one at your local health department.
All right, we'll take a break. Be back right after this.